Good morning. I called for this press conference to give us an opportunity to get an update on the recent increase of coronavirus cases and to hear from our medical authority and our healthcare director who are dealing with this COVID-19 matter. I also have some prepared remarks. We're also here today to discuss the reality that we have been warning you about for the last several weeks. Our new case numbers are going up, and it could not be at a worse time. For the first 2 weeks of this month, the number of new positive cases were in the range of 200 and below. Beginning this week, we saw those numbers jump to 426 on Monday, to 681 on Tuesday, and yesterday, 679. This is also roughly the same time period that health experts are saying that it takes for the coronavirus to incubate. And this comes roughly 2 weeks after Halloween parties and election night gatherings of people. Worse, as the nation passed the 250,000 mark for deaths, Hidalgo County also passed the 2,000 mark. That's 2,000 of our family, friends, and neighbors who have lost their lives to this terrible virus. Yet, we continue to see evidence that people in Hidalgo County are acting like this virus no longer affects us. We saw videos on social media of local businesses holding Halloween gatherings that were packed with people not wearing masks. So I decided to call the press conference 1 week before Thanksgiving to sound another warning. If we let our guard down, more of us are going to get sick and more of us are going to die. The real sad part of this is that during the month of November so far, the vast majority of these new cases have occurred to those in their 40s and below. Those in their 20s represent the largest increase of all new cases. Yet nearly 90% of those age 50 and older are the ones who are dying. Put another way, the younger people in our community are actively going out, actively ignoring warnings to stay home, and are getting infected and taking the virus home to other family members. That's just tragic. Every day, people are asking the county to close down something else. They're pointing out that crowds are routinely gathering within our cities, and they are all demanding that we impose new restrictions to stop that behavior. I'm here to say that no amount of government restrictions are going to save you from ourselves. This must involve people changing their behavior. Thankfully, we are seeing more people wearing masks, facial coverings. We know many people are behaving responsibly, and yet we know many are not. We are seeing more people starting to behave irresponsibly too. And that is what's happening right now. There was no excuse for all the Halloween gatherings and all those people packed in a room without masks. We are now suffering the results. We must change our habits. We must stay home if we do not need to venture out. We must wear facial coverings. We must wash our hands. We must avoid crowds. If we don't change our behavior, I fear that the effect of Halloween has had on our infection rate will be pale in comparison to Thanksgiving and Christmas. The rest of the nation is suffering tremendously, particularly the healthcare system. We went through that in July. We must do everything we can to avoid that again. Our healthcare workers are heroes, but they're also exhausted. We cannot let our desire to get out and socialize continue to impact the admirable work of all of our healthcare professionals. Now, I would like to introduce to you Eddie Olivarez, the head of our Health and Human Services Department, to say a few words. Eddie?
Thank you, Judge. Well, good morning, everyone. My name is Eddie Olivarez. I'm the Chief Administrative Officer for Hidalgo County Health and Human Services. And we're here today to help clarify some issues in dealing with our COVID situation. First, I want to thank all our healthcare professionals in the hospitals and the healthcare community. I want to thank all our first responders, ambulance, police, fire, emergency management. I thank all these people because there's been so much sacrifice involved by so many. Today, we're at 260 days of emergency center operation. 260 days, going on 9 months of operation. And we still have a lot to continue and a lot to do in the months to come. Yes, the months to come. Today, I want to talk about a couple of things for clarity and for clarification. One of the things is that there's been some concern about how we look at our numbers. Today, you will be seeing a report of 679 cases. Let me explain how we're looking at that. One of the things that's important to understand that we're in the middle of a global pandemic, and the method for documenting those cases and assessing those cases is different today than it was 2 weeks ago, is different today than it was 2 months ago, and is different today than it was 6 months ago. Because this is very fluid. The state of Texas has an EPI case criteria guideline that they ask us to use. So those guidelines change periodically as we respond to this pandemic. So out of the 679 cases, we had 162 new cases and 517 old cases. Let me explain. First of all of them were confirmed COVID cases. The difference is the 162 cases were cases that are within 14 days, within that infectious period. Those are those cases. The old cases, as we've reported many times before on the news, and we reported not only here locally, but throughout the state and throughout the nation, there is a huge backlog of data and a large backlog from the state of Texas. So what we're doing is we are getting all our data and putting those confirmed cases into our system. And they have to be accounted for. So those older cases are confirmed COVID cases that may be a few days old to as late as July or August, because that data is just arriving to us due to the methodology the state uses, or that we are catching up with some of the backlog. This has been across the nation. However, what's important to understand, these are confirmed cases. These are real COVID cases. The other thing that we need to discuss is that let's not get into the nuance of it being old or new. Let's look at the fact that these are cases that are impacting our community. We all can help each other in trying to keep this in check and keep the infection rate decreased. What are some of the things that we need to look at? Well, we've had over nearly 40,000 cases, nearly 40,000 cases in Hidalgo County. That's a lot of data, a lot of information to input. And we are doing the best we can with the systems and the infrastructure we have. One other thing to consider, the newest change to the EPI case criteria guide is how we're going to deal with school cases. As you know, there is now testing that's going to be made available to our school districts. We are working extremely close with Region 1, our superintendents, and our school districts here in Hidalgo County. We have 16 school districts, upwards of 300,000 students and staff that work in those districts. What's very important to understand, they will be using an antigen test. So one of the things that I need to explain today is the types of testing. The PCR testing is the one that is the nasal test that is assessed and 95% accurate. And that type of test, if it's positive, is considered confirmed. The antigen testing would be the antigen cases where you might have one called Sophia, that is a digital antigen. You may have the new Abbott AG test that a lot of the schools are using, the Vericore that a lot of the nursing homes are using. Those are antigen tests. And what happens with the antigen test, before you had to have been symptomatic for it to be counted as a case. Now the state is saying, effective November 1st, that if you're positive on the antigen with symptoms or without symptoms, that you would be considered a probable case and it needs to be counted. How did that impact the valley? It impacts us here because the school districts will be getting those kits that are antigen kits, and there's going to be thousands of students and staff tested with those kits over the next several weeks and months and into the new year. Those return to us as positives, we will have to count those. For example, I could tell you right now, as of this morning, we've had 325 confirmed students and staff in our Hidalgo County schools that have been reported to us with official confirmation through the school districts. That's countywide. And that's because they have not had full activity in their schools. 325. We keep track of that on a daily basis, and we work with the school districts individually on those cases. So that's the biggest challenge we got, and you will see a change in that and how we track that. The other challenge we have, and that we're all going to have to work on, is how are we going to deal with the vaccine program? The vaccine is a preventative tool. It is not a cure. The vaccine will start taking place in December into January, and the state of Texas will determine who are the first ones to get the vaccine. It'll be in limited number, and the vaccine is partly being targeted to essential personnel, first responders, medical staff, healthcare professionals. Another essential group might be senior citizens or people who have immunocompromised illnesses or concerns. That is yet to be determined. We will hear that population will be identified in the days to come, and we will work with that population at that point. But stay tuned to what we're learning. We will pass information on the vaccine, but we're excited about it. However, it is not the cure. And it's not going to be publicly available for everybody until the early spring or early January or February. That's when we're going to start seeing it at that time. Dr. Melendez, what are some of the ideas you have and some of the input you have?
Thank you. Good morning to all. Good morning, Judge. Good morning, other panelists, and thank you. I think what I'd like to do very briefly is I'd like to remind us in 3 big blocks of what we're doing this morning. Why are we here this morning today? Why has the judge called us, and why are we communicating with our community? The reason why is because this virus is still in our community. The second block is, where are we right now? And the answer is, this virus is still in the community. The third and final big block is, what can we do? Well, the virus is still in the community. So my message in the 3 big blocks has the same answer, because the virus is still in the community. That being said, we're not in any way in a panic mode. We're in a mode of understanding the numbers, understanding the situation, and with this knowledge, having the power to do something about the scenario. That being said, at the final moment, like in a war, it's how good the soldier does, not how good the general does. All a general can do is put the soldier in the appropriate position so that the war can be won. All we can do is try to give the information to the community so that the war can be won. But in the final analysis, as Judge Rich Cortez has said, and I've said over and over, it's the community. It's the individual family member. It's the individual person that has the ultimate execution of the plan. And so our job this morning is to give you that information so that people of knowledge and people of reason can do what's appropriate. I'd like to review very briefly what Mr. Olivarez has said. The first block, why are we here? Well, the reason we're here is because the numbers are dramatically increasing, and therefore that creates an understandable and expected response from our community, asking, what is going on? Are we going back to July? What is happening? So the reason the numbers are increasing are, number one, we are counting numbers differently. Because it's a fluid situation, and because we want to be systematic with the rest of the state and the nation, then we follow the recommendations of how to count. Before, we were using only 1 test to make it positive. Remember, there are 3 tests. This is not the format to discuss the difference of the 3 tests. Just know, as you most do, there are 3 tests: PCR, antigen, and antibody. Before, we were using only PCR. As of several days ago, now we're using the other two. We're using the antigen and the antibody. Therefore, those numbers are obviously going to go up because we're being a lot more inclusive. Secondly, the subset of people that are being tested now, those people that are actually getting the test now as compared to July is different. Back in July, everyone was getting tested, and rightfully so, because of the fear and because of the impact and the assistance from the federal and state government that there was universal testing. Today, most of our testing are people that have either symptoms or contacts. Obviously, if you're testing people who have symptoms or contacts, your numbers are going to escalate. If you go into a senior citizen home and you test for pneumonia, or if you go to an elementary school and you test for pneumonia, obviously the nursing home is going to have a lot more pneumonias than the elementary school. So such is the case with our current testing. The subset of people that are being tested are much more likely to test positive. Thirdly, the reason the number is going up, remember, number one, more inclusive on different studies. Number two, the subset of people that are testing. And then number three is that we are still playing catch up, not because of incompetency or not because of any other reason, except the numbers were so dramatic, as you know, over 1 million in Texas, so dramatic that we're just getting information funneled to us from the state agencies that we have to incorporate in our counting. So that being said, because the numbers are going up, and because there are good explanations of why these numbers are going up, that doesn't mean that the numbers that we're looking at are without use. There are other reasons why the numbers are going up, such as 2 weeks past Halloween, the schools opening up, the contact sports, the Winter Texans coming down, the lack of restraint on behavior in the community, the restaurants opening up, the alcohol serving places becoming restaurants as opposed to alcohol serving places. So there's other real reasons that we have to analyze why these numbers are going up. But I would like for our listeners to understand that there's also a very bureaucratic reason why these numbers are going up. So reason for concern, absolutely. Reason for alarm, no. Reason concern, yes. Reason for alarm, no. The second, I think, big box that I'd like to discuss is where are we now? We discussed the why we're here. Now, where are we now? Where we are now is in a place where we absolutely do not want to be. The good news is that we're significantly better than we were several months ago. The bad news is that we're far away from what we consider acceptable, and we're in a place with the potential to go back to where we were before. But where we are today is as following. I round in all the COVID units. Example, what we're seeing in the hospital, we're seeing twosies and threesies. What does that mean? That means that we're admitting people to the hospital that is a mother and a daughter, or a father and a son, a wife and a husband, a grandparent and a grandson. So we're definitely seeing community spread. We're definitely seeing family members that are infecting other family members and that are being admitted simultaneously. One particular unit that I visited last week, for example, we had 2 patients. Today we have 19. Another unit, the largest unit, we had 19. In another hospital, we had 19. Now we have 35. So what we're seeing in the hospital is, number one, more family members being admitted, confirming what our excellent CTI has done, which is that it's family spread. Number two, we're seeing the numbers significantly increase in hospitalizations. And number three, we're seeing a lot more people in the emergency departments that are coming in, being processed, and not being admitted. So the hospitals confirm what our numbers are showing, but they also confirm that we're not going from 150 to 200 to 800. That is, we're not going from 150 people in the hospital to 800. That's what we have to be a little bit cautious how we interpret the number. The third big box, why we're here, where are we now, and what can we do? The third big block that I'd like to discuss this morning. What can we do? Well, first of all, we can, number one is not panic. Number two is understand where we are. Numbers are better, but the potential to get further up. And then what can we do based on that information? Well, the recommendations, I think, should be placed in 2 big boxes. The first box is, what are things that we can do? What are things that are under our control? And the other big box is, what are things that are out of our control, but that we need to be keeping an eye on so that we can have some influence in that policy and have some knowledge so that we can adjust to that. So what is out of our control? What is out of our control, of course, are treatment protocols, which include the new antivirals, the monoclonal antibodies, the rapid use of steroids, the antibiotics, the delayed use of ventilators, all those things that clinically we use. The other things that lay people, ourselves in general, have no control over are the vaccines. So as Mr. Olivarez rightfully said, vaccines are that light at the end of the tunnel that we have been hoping and praying for. And what a better time for them to come around than we're seeing such a national surge. Last week, 1 million people died in the a million people got the disease in the United States. 1 million people in 1 week. Who would have thought back in February and March it was going to be so infected? So right where at our record numbers, we have some great news. We have 10 companies, 2 have already announced, Moderna and Pfizer, with expected AstraZeneca next week, and 7 other companies that give us different mechanisms to elicit our bodies to protect ourselves. So vaccines are out of our control. We understand geriatric and medical workers would be prioritized, but within a couple of months, it'll be available to general population. So we are quite hopeful and quite optimistic based on reality and pragmatism that by early next year, February, March, hopefully then it'll be generally available. So those are the things that we cannot do anything about, but that we need to know so we can modify our behavior. Those things that we can do something about, why are we here? Where are we now? And what can we do? Uncontrollable and controllable. Final little box, what can we do? Number 1 is knowledge. Knowledge. Stay informed. Try to understand that all of us are fatigued from COVID and the information. Do not turn a blind ear when you hear the word COVID because you've heard it before and all they're going to say is use masks, wash your hands, and appropriate hygiene. I've heard it a million times. No, there's a lot more information to that. So stay aware and become knowledgeable. And of course, with that knowledge, we have to continue to do the 3 things that we've been saying over and over and over. When we're seeing spikes 2 weeks after Halloween, when we're seeing a tremendous amount of people that are being admitted in the hospitals that are community spread, when we're doing activities that we know are bringing people together, what does that tell us? That tells us that we need to continue to isolate. No one is going to come into your house behind your doors and tell you, you cannot have Thanksgiving, you can't do this, you can't do that. We're intelligent, knowledgeable people. No one infringes on your personal rights. But what we do need to do is remember, you are intelligent, you have some responsibility to your family and to yourself. You know what is the right thing to do. You know, if you have an 80-year-old grandparent, it's a bad idea to bring your cousins from El Paso to visit. That's just common sense. So my last message in closing to you is, please, from a medical perspective, our numbers, our experiences, our colleagues are all telling us the same thing. We're living the same thing. And that is, this virus is in the community. And unlike the other communities in the north, that takes 4 weeks from Dallas to McAllen, like those communities that, look, we're seeing right now, like El Paso, that these communities in the north, Dallas area, et cetera, their numbers are beginning to increase. So within 4 weeks, if we do not continue to do those things that we can to mitigate, we expect for that to come down.
Yeah.
So that's my message to you. And I pause for any questions.
Judge, the first question will come from Christian von Preysing with KRGV. Christian, we are allowing you to talk now. Christian, can you hear us? We can't hear you.
Kristen is on mute, it looks like.
Well, Judge Christian typed his question and he's asking, why have we seen bars in downtown McAllen operating when you have not authorized their full reopening?
Well, I'm going to partly let our legal counsel answer that question, but this is how it works. There are two types of license for bars. One is the blue license or blue paper, and the other one is the red. The blue means that establishment is selling more than 51% food over alcoholic beverages. Those are the blue licenses. I believe there's 730 of them here in Hidalgo County. Those are free to operate under certain conditions. The other license is the red label license. Those are to sell more liquor than to do food. Those are the ones that should not be operating today. So I wouldn't know whether you're talking about a blue label license or a red label license. But irregardless, the ones that are responsible to enforce the rules of the state of Texas, the rules of the county, and the rules of the municipalities are the law enforcement of that municipality. So if this bar happens to be in McAllen, then it's the McAllen municipality and their law enforcement people are in charge with enforcing the laws. Josie, do you want to add anything to that?
Sure, Judge. Just as a matter of clarification, the county's order as well as the governor's order allows the red sign bars to continue to operate to the extent they are selling takeout or delivery. So patrons can still come to pick up and take out alcoholic beverages from the red sign bars. The blue sign bars are the ones that have qualified with the Texas Alcohol and Beverage Commission to be able to operate as a restaurant because their sales, their gross sales, 51% of them or more are not related to alcoholic beverages. And so for that reason, those are the businesses that are allowed to operate at 75% capacity under the governor's order as well as the county's order, keeping in mind that there are still minimum standard health protocols that are recommended by both the governor as well as by the county. And just to go over those quickly, these would be things like not permitting customers to loiter at the bar or in the common areas, only permitting patrons to eat or drink while seated, discouraging activities that enable close physical contact, specifically in bar areas. Groups should maintain social distancing, a distance of 6 feet, no table of groups of more than 6 people, as well as adhering to the health protocols for employees. So those are some of the things that the blue sign restaurants or bars are able to operate so long as they have those protocols in place.
Other questions from the media? If you have a question, there's a button at the bottom of your screen that says raise your hand. Meanwhile, there's a question on social media. Eddie, I think would you handle. The question is, why are you including antigen tests in the count? They seem to be highly unreliable.
So, as I said earlier, the new EPI case criteria set forth on November 1st by the Department of State Health Services has indicated that they are wanting us to look at and start counting as probable cases and we consider it in our count in accordance to the state guidelines and support. So those are confirmed antigen tests with or without symptoms. And we're following the state guidelines.
Other questions from the media? Judge, another social media question to you, sir, is do you plan on shutting down any businesses again?
As of today, the answer is no. In fact, we're going the opposite direction. We want to make sure that the businesses are open, but we want to make sure that businesses are open in a safe environment. We are pursuing the idea of having some consultants be available to businesses here in Hidalgo County to have a seminar to teach them in various phases or how to operate safely in this environment. And we want to be able to give a certification that you've gone through this training, and hopefully, be able to allow more businesses to be open and stay longer. We're going to be discussing with the governor's office to see if we can get our businesses certified to be able to operate safely, that maybe he can even give us the opportunity to operate at full capacity. We're not going to do that. We're not going to do that if our numbers continue to increase, and we're going to put people in danger. But the short answer is no. I'm not planning on any closing down any businesses.
The next question comes from Daniel Montes with the Rio Grande News. Daniel, you are able to talk now. Go ahead.
I'm having trouble.
We can hear you, Daniel. Go ahead. Okay, another social media question, Judge, is what about opening the bars?
Well, it pains me tremendously to have them closed, because they have every right in the world to be open and to be in business. But every health official that I speak to, the Center for Disease Control, everyone puts bars at a very, very high risk. So we're working on trying to come up with a plan, again, trying to figure out how bars can open safely, so we can put them back online to work. So we're working on a potential policy or potential way that we can open them. And like I said, it just pains me tremendously. And it's not isolated to Hidalgo County. It's most counties throughout the state of Texas still have their bars closed. Josie just mentioned how they can open. I mean, they have some limited ability to operate. Josie, you want to go through that again?
Sure. Texas Alcoholic Beverage Commission has given the red sign bars the opportunity to apply to or to qualify to open and operate as a blue sign bar, meaning that 51% or more of their sales would have to be from something other than alcoholic beverages. So there is an opportunity for them to apply to TABC and to qualify to open. At this point, the county has not opened up the red sign bars.
Our final question comes from Christian Van Pressing with Channel 5. Christian, you're able to talk now. Christian, you're unmuted. He was having problems with his mic earlier. We cannot hear you, Christian.
Carlos, there's a very faint sound in the background, but you can't make it out.
Okay. Unfortunately, we cannot hear him. So this will conclude our press conference. Thank you very much for your all's time.